Hi, Sistah Doctor here, and I just wanted to come and talk to you for a few quick moments about stress and the need to take care of ourselves.
Hey, Sistah Doctor coming to you again to share some truth to empower and resources to heal.
I know from the moment that I started doing these posts and videos on Facebook and YouTube, I've been saying take care of yourself. It's kind of been my thing. But there's a reason why. I know we often hear that old saying that you can't pour from an empty cup, and that's true, and it's been an encouragement to remind us that the more we give, we have to take a moment to stop and kind of refill. Well, I'm going to use a different cup analogy to talk to you a little bit about what stress is, how it impacts us, and why we need to take care of ourselves, and why in today's time, with everything that's coming at us, we might need to step up our self-care game in order to combat all of the different things that are being poured in. So imagine for a moment a cup, empty cup, whatever size you'd like, really doesn't matter. The point is, what fills up that cup? All of our cups, if you can imagine this cup is you, this cup comes pre-filled with something in it. If you think back to your Biology 101 class, we would call that the diathesis, the kind of nurture or biological piece in there. Some people are predisposed genetically to anxiety or depression or things like that. So if you've had individuals in your family that have a history of anxiety or depression, whether it's been diagnosed or not, you might just have somebody you know who's always worried a lot, been really high strung, always kind of nervous, then that's probably an indication that that cup is filled up a little bit with some predisposition. Someone who's always seemed just kind of blah, not real easily excited by things, or easily discouraged and saddened and stuff. Probably an indication of some predisposition. Substance abuse, whether it's alcohol, drugs, other things, that's often the way that people self-medicate, might be an indication of some genetic predisposition. Also, if you yourself have always considered yourself to be high-strung or nervous or prone to those sad moments. Not the everyday sad moments because something sad happened that we can all experience, but the sad moments that kind of hit and are hard to come out of. If you had that and you've noticed that it's like, that's been me my entire life, that's a sign of a genetic predisposition. Earlier start, family history, very intense symptoms when they do begin, kind of signs of either genetic predisposition or something really major that happened early on in life. But I'll get to that in a moment. So imagine that cup, taking all those factors into account, and where would it be for you? Would it be just a little bit, a lot? How much is that diathesis or genetic predisposition? Imagine your cup and where it would be filled. Now, the next part we need to imagine is the stress in the diathesis stress model. That's the environmental piece, the stresses that you live with and experience on a daily basis. All of us have some stress, and not all stress is bad. Some stress helps us to grow and strengthen. Imagine if you're a weightlifter and lifting weights, there's a stress on your muscle, and that stress tells your muscle that it needs to grow stronger. So some stress is actually good in that regard, whether it's physically or even mentally. A little bit of stress because of a test coming up encourages you to study. Those things we sometimes refer to as eustress or good stress. Stress can also be bad or negative, and that is often determined or indicated by how much stress it is and if it overcomes or maxes out your capacity to deal with it, your threshold. So imagine that cup again. The top of that cup, that's the threshold. So whatever your diathesis was, the rest of that is how much you have left to deal with the stress of life. What are some everyday stresses? Oh, you might have to get to work at a certain time, do whatever you do at work or school. There's bills, there's tests, there's potential conflicts or arguments with friends or family or coworkers. there's a number of things that can occur there. And whatever that is, on your kind of average daily basis, you fill that up. There are lots of different scales you could do, so if you're not quite sure, look one up. You can Google a life event scale. I believe Holmes and Rahe is one of the people who does one. And it has a whole list of different events, from those everyday things like bills and tests, to conflicts and arguments with folks, to things like, I don't know, being foreclosed on, or getting a divorce, suffering a breakup, losing a loved one. Those things are big stresses and add quite a bit into that cup. Some people manage them quite well, and part of that would be because as they fill up that cup, they still haven't maxed out their threshold. They're feeling stressed, but they're not quite to the point where you start seeing this overflow of symptoms that become dysfunctional and disruptive of their life. Other times, people experience things that max that out. Some of that depends on the nature of the stress. Some of those things I just mentioned are bigger than the others in their impact on an individual. Some of them have to do with just the cumulative effect. If you've had one stress, you can imagine that fills your cup a certain amount, and depending on the stress, it may or may not max out your threshold. If you have stress after stress after stress after stress, you're getting closer and closer, more likely to max that out, right? So, again, imagine that cup that's you, wherever your diathesis is. What are kind of your everyday stresses? You might also want to think about something that has to do with things we experienced in our childhood and our early life. Adverse childhood events, or ACEs, you can Google that also, are these events that occurred pretty early on, such as living in a home where a parent was addicted to drugs, or experiencing some sort of abuse, or living in impoverished conditions. Those things have ongoing impacts and aren't always the things that we think about when we think of our everyday stress, but they add into that cup. In epigenetic research, I'll talk more about that later on Sistah Doctor, but basically the short of it is that lets us know that that diathesis and that environmental impact works together and has some impact. So if you've experienced any of those ACEs, there's actually a little more in your cup than maybe you thought. Again, reducing our capacity to deal with other everyday stresses. The other thing I'll note for some of us people of color and women and other people from historically oppressed groups, little things like microaggressions and the everyday things that you deal with that add some stress and sometimes cause you to wonder, did you even experience it? Those things aren't always on those scales, but they're adding into your cup too. So you take all that into account, how much is left in your cup? A little bit? A lot? Whatever it is, can you now imagine why, if you're at a point where, I don't know, you sit and start scrolling through your Facebook and all of a sudden you're starting to just feel tense and stressed and irritated and upset, you might be maxing out that threshold. So what do you do, especially when you might be flooded with things on your Facebook every day lately, or when news in general can be pretty stressful, or maybe you've run into a situation and had an encounter with someone that's been, pretty ugly and stressful. How do those things then get added in, and how do you heal from them? That's the important part. These things are going to keep coming, and so we have to find some way to de-stress, to keep that level down so that we're not always maxing out and going over and having these symptoms, because those have negative impacts on our bodies. Blood pressure rises, immunity reduces, heart rates it can increase when we're feeling stressed, all sorts of things. And while the nature of this video isn't to talk about all of those impacts, because they're there, we know that it's important to start to reduce that stress and take care of ourselves. So what do you do? How do you start to, in essence, take some of that water out? Well, there's a couple of things, and definitely search Sistah Doctor for resources, because that's why I'm doing all of this. But things like the meditation and mindfulness exercises, which I know some people go, ooh, wait a minute, I don't know about that, feels kind of new agey, or ooh. Can be, if you use it for a religious purpose along that tradition. But there have been meditative traditions in all religions, Christian and other. And whether you're doing that through a prayerful meditation or a meditation that's thinking on positive things, or simply a practice that has you pause, the kind of stop and smell the roses thing, pause, relax, and just pay attention to how you're feeling, so that if there's anything going on, if your muscles are tense, if your thoughts are racing, if you're just not feeling well, that it cues you in sooner rather than later to do something about that. And then you get to choose what to do. You get to choose whether it's taking a break and spending some time with friends. That'll take some water out of that cup, help you kind of reground and refresh. Maybe it's just, I don't know, doing a spa day or soaking in the tub at home. Maybe it's reading a good book. Maybe it's doing any number of things. But the point of it is that it helps to relieve some of that pressure and the stress, so that you're better able to function without maxing out your threshold. There are other things that we might need to do that can actually increase our coping, in essence, increase the size of the cup, if you will, so that we have even more space to be able to deal with the stresses that are coming. But again, if you can imagine, in today's time, with more and more being constantly poured in, we have to keep working on ways to take stuff out. Because just a little bit every now and then might not be enough. And if you find that you had a good routine of self-care, you worked out regularly, you tried to eat healthy, every Friday night you hung out with your friends, and that's not quite cutting it anymore, it might mean that more is coming at you than used to. And so you need to do more now to maintain a balance that feels good for you in your life. So, hope all that was clear, and that the cup helps you understand what's there for you, what pre-filled your cup in terms of the biological piece, what stresses you live with in your everyday life, and what's been going on lately. And that helps you to think about the different things that you might be able to do to better take care of you. And again, Sistah Doctor is going to be here continuing to share truth to empower, those different things that help you to better understand what it is that's impacting the stress that might have been there kind of generations ago and passed along, what might be there in the society and community at large that sometimes we don't even understand how they're impacting us, and what's going on in our everyday lives. And then those resources to heal, the things that can help us really learn how to de-stress, renew, re-strengthen our minds, our bodies, and our souls, so that we can be everything that we were destined to be. This has been Sistah Doctor, your resource for more truth to empower and resources to heal.